Hello, this is David Crook, and today we're going to be talking about renal ultrasound. So the objectives today, we're going to look at the indications for doing this type of ultrasound, the technique, and then finally grading hydronephrosis. So when we do it, so overall this is a very quick, easy to do test. It can help, lead us in one direction or another in imaging, whether we're doing without contrast CT, with contrast, or even potentially just a renal ultrasound formal. So symptoms we're usually looking for is flank pain. We're looking for people with hematuria or a urinary incontinence or retention. So for these, we're looking for kidney stones, and usually we're looking for a backup or hydronephrosis in the kidneys. Also for hematuria, we're looking for renal mass. We're looking for any large structures or masses or complex cystic structures in the kidney. And then for acute urinary retention, we're thinking more, just remember that renal ultrasound also includes the bladder. So looking if there's any significant distension, any blood clots that would be leading to that urinary retention. So technique, we usually are using the curvilinear probe. We're going to have the patient in the supine position, and we're having the probe marker facing the right shoulder. You can use a phased array or a cardiac probe as well. I just find that oftentimes I'm getting better, more detailed images of the kidney. If you do, however, have difficulty obtaining the view because of ribs getting in the way, causing obstruction, I would recommend trying the phased array probe. Just remember, two views. One view is no view, so make sure to get it transverse as well as sagittal. And don't forget about the bladder. Go down and take a look at the bladder as well. Make sure there's nothing there. That would explain your patient's symptoms. So looking at a quick look at the kidney anatomy. So we have the renal pelvis right here, right in the middle. We have the major calyces followed by the minor calyces. And then the cortex, the renal cortex. So that's all the parenchyma of the kidney. So if we're looking at how to grade hydronephrosis, if there's just fluid, if there's just hypoechoic areas in the pelvis, we're looking at just a grade 1. And then all the way to grade 4, which is, you have thinning of the cortex because there's so much dilation, so much hypoechoic fluid inside that pelvis and the calyces. Grade 2 and 3 are sometimes difficult to distinguish from each other. We usually just lump those into moderate, so there's mild, moderate, and severe. Moderate is grade 2 and grade 3, where it's, major versus minor calyces. For all intents and purposes, we like to do it mild, moderate, severe. Mild just having the renal pelvis, moderate with the calyces, and severe with the thinning. So looking at some this would be a right upper quadrant look at the right kidney. So as we can see here, it looks like it is going definitely into the pelvis, even some into the calyces, probably even to the minor calyces. So this would likely be a grade 3, definitely in the moderate range of hydronephrosis. Now this is an interesting one that one of our residents did. And as we can see, not a great first view. We see a large circular hypoechoic structure. Can't quite tell at this point what it is. It could be the gallbladder, right under that right upper quadrant. Right under that liver in the right upper quadrant. So it could be that, but also pretty close to the kidney. So we'll need to take, as I like to say, that second view look. So we look at the sagittal view, and we see it's just barely corresponding with that kidney. So it's definitely in the cortex of that kidney. So it is a endophytic cystic lesion on the right kidney. It's important to be able to follow that and see that it's actually part of that kidney. It's not the gallbladder. We do not need to include it in our gallbladder ultrasound. but likely just a simple cyst of the right kidney. Here's another view of it. Got another look at the kidney here, looking like potentially a little bit of just mild hydronephrosis just inside that renal pelvis, maybe edging into the calyces, but looks mostly contained in that pelvis. So I would say this is a mild amount of hydronephrosis. And then this last one, as you can see, it's pretty obvious that there is a large amount of hydronephrosis here. I mean, you can barely even see the cortex between that and I think likely the liver there. So this would definitely be on the severe range of hydronephrosis. Likely has some kind of obstruction in the way, whether that's kidney stone, mass, bladder stone, things like that. Here's another one. Hydros going in, that hypoechoic going into the calyces. So we would rate this as a moderate amount of hydronephrosis. So parting thoughts, learn your grading of the hydronephrosis. I would also add to this that always compare sides. Some people, especially when they have a mild amount, that could be an obstruction, more forward in the path in the ureter or the bladder, but sometimes people just inherently have a little bit of hydro. So look at both sides, compare, see, no, kind of both sides look, they just have mild hydro. And then don't forget about that, the bladder portion of your renal ultrasound. Also, to distinguish between cysts versus gallbladders, remember to look at the full structure, see where it's actually contained in. And I would say that renal ultrasound is very important in our severe AKIs, the renal failures, to see if there could be any obstructive components.